Hi, this is Zoe from Carepatron. Before you watch this video, don't forget to like and subscribe for more content like this. A nurse neurological assessment is a comprehensive examination performed by nurses on patients suspected of having neurological disorders or issues before they are passed on to neurologists for further testing. During this assessment, nurses will need to do two types of examinations, subjective and objective. For the subjective part of the nurse neurological assessment, nurses will focus on gathering information based on the patient's perspective regarding their current neurological status. They will ask a patient questions about any possible symptoms of neurological problems that they might be experiencing, like headaches, feelings of numbness, tremors, loss of balance, and feelings of weakness. Once they're done with the subjective part, the nurse will proceed with the objective part. For this part of the assessment, they will perform a series of inspections, osculations, and palpitations on the patient. Nurses will check on the patient's orientation, level of consciousness, behavior, and more. They will also conduct a series of tests like mini mental state examination, PERRLAI assessment, a balance and coordination test, motor strength test, and even a cranial nerve assessment, to mention a few. To use our free nurse neurological assessment, follow these steps. Download our nurse neurological assessment from the Carepatron platform, which you can find in the link in the description. The nurse should prepare certain supplies for this exam. These include the following. The nurse must also ensure that they keep in mind and do the following throughout the assessment. They must be organized and systematic, use appropriate listening and questioning skills, listen and attend to patient cues, ensure the patient's privacy and dignity, assess the patient's ABCs, as well as maintaining constant hygiene. They will start with the subjective part of the assessment. They must ask the patient the following questions. Are you experiencing any current neurological concerns such as headache, dizziness, weakness, numbness, tingling, tremors, loss of balance, or decreased coordination? Have you experienced any difficulty swallowing or speaking? Have you experienced any recent falls? Have you ever experienced a neurological condition such as a stroke, transient ischemic attack, seizures, or head injury? Are you currently taking any medications, herbs, or supplements for a neurological condition? During this part of the assessment, the nurse should note down the patient's behavior, language, mood, hygiene, and choice of dress while asking the questions listed above. Using the tools prepared, the nurse will conduct a series of tests, as stated previously. To document all their findings, they can also do this after each part of the assessment. It's important to document them to pass information to other nurses or doctors handling the patient. Here is a sample of our nurse neurological assessment, which you can find on our Carepatron platform. To find our nurse neurological assessment, go to our Carepatron platform or click on the link on the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.